You're watching TV9 News and I'm Prajwal D'Souza. Ever since the COVID-19 pandemic began, health authorities were finding ways to control the pandemic and reduce the mortality rates in the country. Now, one such therapy which was being administered was plasma therapy. With the demands for vaccines and medical oxygen, there was also a need for recovered patients to donate their blood plasma to treat infected patients. Now it is being suggested that the treatment should be dropped from the clinical management guidelines for COVID-19 infected patients. Now, before I tell you why the decision was taken, let me briefly explain what is plasma therapy. In plasma therapy, the blood of a recovered COVID-19 patient is extracted and then injected into another patient. The plasma of the recovered patient contains antibodies which was believed to help infected patients recovery time and fight infection. It was also believed to ease some of the symptoms. Now that we know what plasma therapy is, let me bring you up to speed on what is happening. According to a recent report, the Indian Council of Medical Research, or the ICMR's National Task Force on COVID-19 has suggested to remove the use of convalescent plasma therapy from the guidelines. This information was revealed to news agency PTI through sources. The sources also said that a detailed advisory will be released soon. The decision to remove the therapy is being made on the backdrop of some clinicians and scientists who had written to Principal Scientific Advisor K. Vijay Raghavan and had cautioned against the irrational and non-scientific use of convalescent plasma therapy. The clinicians had argued that current guidelines which allow the use were not based on existing evidence. Under the current guidelines, off-label use of plasma therapy is allowed at an early moderate stage of the infection, which is within 7 days on the appearance of symptoms. So what happens next? Was the evidence unclear? What should the patients do who have already taken plasma therapy? Will it lead to any side effects? I spoke to Dr. Sitesh Roy, a clinical immunologist from Mumbai, and here is what he had to say. Doctor, why was the plasma therapy approved even if for off-label use in the first place?
So plasma therapy, when it was originally done in China during the first wave of COVID-19 back in May 2020, the first publication that came out showed that it was highly effective in a small group of patients who were in the ICU and battling for their life, and with very carefully selected donors whose plasma titers of the COVID-19 antibodies were above a certain level. There were very good results and almost 90% of those patients survived. And hence the whole idea of possibly using this as a therapy came up. But subsequently it became very clear that unless it is done correctly, this therapy is not very effective. So I think that the first initial success with plasma therapy that was noted in the couple of trials back in the early part of the pandemic led to this being used more widely around the world.
Does the therapy lack scientific evidence currently?
I would have to say yes, Prajwal, because the subsequent studies that have been conducted with donor plasma from those who have recovered from COVID-19 have not shown the degree of improvement that was seen from the original trials from China and Italy. So at this point of time, the way plasma donation and therapy is done for COVID-19, without really accurately studying the level of neutralizing antibodies in the donors before actually transfusing it to patients who really need it. Also, the use of plasma therapy too early in the disease when it is not required have been two reasons why the therapy has been failing, and hence the scientific evidence to support its use in the current manner is not there.
Have you come across any patients whose recovery was improved due to plasma therapy?
So Prajwal, whenever plasma therapy is chosen to be done for a patient, it is never done in isolation. It is done along with antiviral drugs like remdesivir or steroids and other such therapies. So to say that it was the plasma therapy that led that person to get better or to improve is a very tough situation, and hence in the clinical trials where it has been studied independently, recognizing that the standard of care is there along with it, it was found to be not greatly beneficial for the patients in terms of their duration of hospitalization or prevention of death or mortality. And I think that is why it is slowly falling out of favor, and the inclination has been towards the monoclonal antibody therapies. But even in the monoclonal antibody therapies, single monoclonal antibodies are failing, and you have to use combination of two different monoclonal antibodies against the spike protein for there to be success in the therapy.
For people who have received the therapy, should they worry about any side effects?
Fortunately, no, because generally plasma is something that is, as long as it is transfused based on all the current protocols that are there to prevent transmission of infections that may be carried by blood, what is called blood-borne infections, and also to prevent any kind of reactions that might occur during the transfusion. Since all of these are taken care of in today's day through the blood banks and all the protocols that are there, I do not really think that people who have received it should be worried about any side effects or long-term consequences. This is generally a safe therapy, and it is used for many different diseases, including something as common as someone who has had bad burns and has lost a lot of protein from their body due to their burns. Plasma infusion is used very commonly, and also through certain surgical procedures. So nothing to worry about in that.
As of now, the information is based on sources, but from what clinicians have suggested, it looks like the center might drop the use of plasma therapy for infected COVID-19 patients. Do let me know what you think in the comment section down below. If you like this content, do give this video a big thumbs up. Don't forget to subscribe to TV9 News on all the social media platforms. Thank you for watching and stay safe.